All right, hang on 1 second. Good afternoon. Please grab a seat. Please grab a seat. My goodness, this isn't a state dinner or a state event. I'm really grateful to join you today, and these are exciting times in West Virginia because we have a chance to be truly transformational and take advantage of an opportunity that President Trump gave us in the big, beautiful bill to really move our state to another level. Over the last year, I've been talking a lot about how West Virginia needs to get healthy again. And a lot of people say these are just words. But we've been working tirelessly for a vision to help get people better. I was talking to people better physically, getting people better mentally, ensuring that the next generation of West Virginians puts health at a premium. And it's because there's a simple concept that we're trying to advance. We believe that when healthcare outcomes improve, more people go to work. Workers become more productive. When that happens, our economy gets strengthened and the standard of living of our people rises. Good health begets a good economy. And then the circle continues. A good economy helps us invest in healthcare. It helps us further improve healthcare outcomes, which in turn drives more workforce participation, which in turn makes our economy go, and so on, and so on, and so on. And I'm talking about this from a positive perspective because that's the direction we're heading in now. That's not always been the direction we've headed in. As you know, the opposite had happened for a long period of time when we've had difficult economic challenges, and that helps lead to some of the poor healthcare outcomes. And that reverse cycle was really tearing at West Virginia's ability to compete and to grow and to be as successful as we all want it to be. Yesterday's announcement begins another chapter to allow us to change that dynamic. It's very, very exciting. We filed an application with the Center for Medicare and Medicaid Services for a rural health transformation grant. Now, this is the provision in the big, beautiful bill that set aside a minimum of $500 million for each state to invest in their citizens. It's exciting because it's probably the first time, at least in my memory, that you have initiatives going toward prevention and education and getting people healthier at the front end of the equation. And the thinking behind that was, if you put a lot of money in the front end, you would save a lot of resources at the back end. Now, quite frankly, that's a common sense idea. And it stems from the old adage, an ounce of prevention is worth a pound of cure. That's where we are today. And I'm so happy to come here, and we had an announcement yesterday, and we've been going around the state talking about the details of our rural health transformation because I think it's crucial to our state's success. And I want to thank all the folks that came out today to celebrate this fact, because I think you'll find as you start to learn more about the work that we've put in over the last few months and the work that a lot of people in this room have put in the last few months, you'll realize this is the opportunity for our state to really move to the next level. And we are going to take advantage of it. The application we've submitted and the programs we're proposing, they're about affordability. We know the price of healthcare services and goods too high. We have to change that. We have to of our citizens. We know it's about accountability. We know it's about accessibility as well. West Virginia needs to keep striving to have more healthcare access, to be a lever to help improve those healthcare outcomes. And of course, it's also about the creation of a dynamic workforce. West Virginia has the lowest workforce participation rate in America today. That must change. That's the #1 issue we face as a state. I've said it repeatedly. It may get lost when people wonder what we're working on every day. 99% of the time, we've got the laser focus and say, we're going to lift up our state, and you're going to do it by driving workforce participation higher. That's our focus. And that's because we know that that's going to lead to a much better future for our families and make West Virginia a better place to live, to work, and to play. So this moment matters, but it didn't just happen overnight. The truth is, we started working on these initiatives earlier in the year. Some of you may remember when I got together with Secretary Kennedy back in Martinsburg. It was back March 29th, if I recall correctly. We rolled out a 4-pillar plan to make West Virginia a healthier and a more vibrant state. We focused on the fundamentals. We talked about cleaning up our food. We talked about giving people more purpose and getting more opportunities to work. We talked about I mentioned this again, getting the crap out of our food. There's so much nonsense in our food. That has to take center stage. Legislature's done a lot of things to advance that. We also focused on ways we can stay active and move and exercise. There are a lot of things that we announced that day, but that was the beginning. Fairly straightforward ideas. They were grounded in personal responsibility, which will lead to community renewal. Now, at the time, I probably couldn't have imagined how much momentum we would gain with some of these pillars. But we are seeing real response to some of the things we've done. I'm encouraged by it. And in part because people know they want to do things that are good for them. Take the Mountaineer Mile, for example. Earlier this year, I challenged West Virginia counties and West Virginia citizens to step up and walk at least a mile. And I was clear that, look, people sometimes took shots. Well, he needs to walk a few Mountaineer miles. Yes, I did. And yes, I do. There's no doubt. Own it. And that's what we're doing. I can report to you that we've stayed true. I've not missed a day. Not only the Mountaineer Mile, we've averaged over 12,000 steps since that day. And while it's far from over, and I'm going to tell you it's very difficult, I can report today I've lost 12 pounds since that day. A lot more to do, but if I can do it, and I know how difficult it is, a lot of other people can too. I think it's worth pushing for that. And so I'm excited about it. And a lot of the things we were talking about really come to fruition in this rural health opportunity that we're provided right now. Now, poor health, as you know, isn't just a medical issue. It is an economic one. And I'm excited to roll up our sleeves and get to work to tackle some of the most difficult disease states that we have. We're at the bottom: obesity and diabetes, COPD, asthma. There are a lot of areas where we can make meaningful improvement. And I think this process we're talking about is going to help make that happen. Now, the program that we're talking about will provide a minimum, if we're accepted, of $100 million a year for 5 years. My hope is we're going to have far greater resources than that. Now, I'm not the decider of how much money West Virginia gets, but I can promise you we're going to go and we're going to visit these people. We're going to explain why West Virginia represents the single best opportunity in America to demonstrate transformational healthcare changes which will lead to better economic outcomes. I can't imagine a state better positioned than we are to show progress. So it's exciting. I think we have a great story to tell, and it's consistent with what we've been doing throughout our administration. The very laser-like focus on healthcare, on economic outcomes, and ways that we can actually get the fundamentals better in West Virginia. Not just be focusing on things to beat your chest, to have a press release and say, hey, I bought a company. That's nonsense. We need to win the competition by having better fundamentals. And what better place to start than healthcare, where the fundamentals have been pretty tough. That's why we're working on it. But I tell you, we're going to make real progress, not only through this application, but through all the great work that's been done. As people get healthier, we see that disability roles can shrink. Workforce participation rises, productivity is going to increase. That's important. And ultimately, when you have productivity increase and workforce rising, we're going to have an expanded tax base, and we're going to be able to keep more of our kids at home. Now, what I'd like to do is just take a couple minutes and walk through some of the core elements of our plan, and I think you'll like it. This is a practical plan, once again, focused on improving accessibility and affordability. For every West Virginian watch it, I feel your pain in terms of what's going on with the high prices and the challenging economic conditions. And I want you to know that we're working very hard to provide that relief. I think what we're doing here can be a critical piece of it. How do you drive affordability? Well, one way you do it is you actually have to bring healthcare closer to people. Telehealth needs to be a staple of the new system, where we bring people close to the services that get provided, or bring the services closer to you. So we'll be investing significantly in telehealth. That means new opportunities for hospitals, for other providers, for federally qualified healthcare systems, and other entities. It means telehealth can be located a wide variety of different places. It's exciting. We think we can leverage some of the EMS systems out there to have treatment in place programs, and many other providers who have been struggling. This could be a real win for the Mountain State. Second, we know transportation has been a big problem here in the Mountain State. Not just the number of miles from place to place. Well, people know that West Virginia is a rugged place, difficult to traverse. You may say 15 miles, but it might take a half hour to go through hill and holler and to get to that place. We know that here in West Virginia. And so we have to do a better job of connecting our citizens through the transportation systems. And so that's part of our platform, connecting medical transportation, public transit, community ride programs. Once again, tapping into EMS, what they're doing. We're doing some really neat work here to create a one-stop health mobility program so people can access greater tools in transportation. Third, we're investing very heavily in our workforce. I want to say a couple words that I hope that you'll repeat to many people. Recruit, retain, retrain. Recruit, retain, retrain. West Virginia First needs to identify so many new people within our state today in the high schools, the technical colleges, and let them know that there's literally an unlimited number of healthcare jobs out on the horizons, whether you're talking about primary care physicians, allied health professionals, a lot of pharmacists, lab techs, so many good paying jobs that can keep our kids home. That always we have to start there. We have to keep our kids home. That's a core part of what we're trying to do in our investments in workforce. We also, though, have to become a much better net migration state. Now, I'll tell you, we're making some progress on that. We've seen a net migration in recent years, but unfortunately, there have been more deaths than births over the last number of years. That's why we lost a congressional seat. We have to reverse that, accelerate that net migration. And we have to do that through a lot of the incentives to let people know about wild and wonderful West Virginia. People know it's a beautiful place, but now we have a chance to tell them about all the other amazing qualities of our citizens and all the opportunities you're going to have available for you. So that Mountaineer Care Force is a central part of this application, retaining West Virginia's future providers. We'll be building on the efforts. This isn't a situation where we're displacing existing efforts. If WVU or Marshall or Vandalia and others are investing in a particular space, they're going to keep that up. But you know what? Now they get a little more help to maybe go a little further in their recruiting efforts. That's important, and that's very, very good. And that might allow us to improve the total number of people that are serving patients in these rural areas. Exciting opportunities. Guess what that does as well? That increases workforce participation, which in turn drives better economies and feeds back into improved healthcare. It's a cycle, and we have to make it a very positive cycle. Mountaineer Care Force, central piece of this. Then, we have to modernize our healthcare systems. We have to make sure that we're investing and helping providers and consumers save money. Once again, let's go back to affordability and accessibility. But we have to help folks because we know there are a lot of challenges. There's a lot of infrastructure that needs to be developed so that local clinics, FQHCs, hospitals, other entities can afford to invest in the technology tools, the AI, the modern systems they need to do. We have to be looking at value-based care models to make sure that our consumers are getting the best value for the healthcare dollars that are out there. In this area, it's my intent to bring together the healthcare systems across West Virginia to have those good discussions. You can't put it together in a month when you get an application coming in, but we've signaled in our application how important this process is, and we're excited about it. We think there are opportunities for shared service and savings in that area, and we want to make sure that we're paying more for outcomes, not just volume. Fifth focus, another very exciting one. How do you put more West Virginians to work? How do you connect recovery, readiness, and wellness programs? What's going on in the community? What's happening with employer systems to help West Virginians find work? Health and economic strength go hand in hand, and so we want to build on our recovery to work programs. If you're a state that has the highest disability incident rate in America, you have to find a way to change that. Not only for our young, but for people currently disabled. Even leveraging to get some ability to take people who are disabled to do some work. That makes a big difference. Work is good. Work is moral. Work is the West Virginia way. We're going to keep advancing that, and we're going to give people more opportunities than they've had before. I'm excited about this, and this is going to build on the other initiatives that we're advancing in West Virginia. And I'm eager to work with the legislature next year to do more in this space. I'm looking around. I see a number of the legislators here. Joe Statler, excited to work with you. I saw Jay Taylor. There's another Ben. Where's Ben? Ben Queen? I can't see him. Oh, Ben Queen. He's all the way in the back. All these people. We got a lot of good people here. We have a chance to really focus on these issues and build on what we did last session. You know, last session, one of the big accomplishments, we did a licensing reciprocity bill that actually is already proving to work. 10% increase in the number of people applying for contractor licenses. People who have professions, it could be nursing, it could be doctors. If you can come into the state and get to work right away, that's attractive. That's the kind of stuff we want to do. So a lot of positive things we can build on. Then we get to our sixth initiative, something a lot of you have been hearing about since President Trump took office and since RFK became the HHS secretary. We're going to be building on that Make America Healthy Again movement by focusing on using food as medicine and nutrition, empowering West Virginia to lead healthier lives, emphasizing movement. This is where the Mountaineer Mile comes in, but we've also set up really positive contributions, different ways that West Virginians can lose weight, competitions between schools, competitions between counties, with some incentives and some rewards at the other end of the process. Bring back the presidential fitness test, making physical movement an important part of everyone's future. I remember growing up, that's what we did. Not that you should use me as the example today, but I'm trying and I'm making progress. And that's what's going to happen for all West Virginians. It's exciting. Then we get to another thing that I'm really excited about. And Dr. Razai, I'm really grateful you're here because of the incredible work that he's doing at R&I. It's really world-class in nature. We have a program called Health Tech Appalachia. And it's a new effort to grow healthcare innovation and boost our economy by supporting AI, digital health, and consumer-focused technologies. The work that's done at R&I, WVU, Marshall, the Osteopathic School, many other places across the state, we're going to have an opportunity to invest directly in those institutions to help them succeed. That's really exciting. And so I will tell you, part of the reason for that is I went out and a little less than 2 months ago, I had a chance to go to R&I and see firsthand what they were doing. It's amazing. They're at the cutting edge, and they have people across the globe envious of where they are. We've got to make that go stronger and stronger. I'm excited to see that happen. That's not only going to help healthcare, though. That's going to allow us to take those incredible technologies, once they're patented, to commercialize them. And then that leads the way for broad new economic opportunities in the state. This is how West Virginia is going to get out in front and lead. And this is the precedent that we get to provide for the nation, the model that people look at. How do you bring affordability and accessibility to a state that so badly needs to improve healthcare outcomes in order to drive economic outcomes? And I look out at this room, and it's very fitting that we're here today. It's a lovely school that's here, and I'm glad to be back again. I look out and I see a lot of the future of West Virginia. You see, you're going to have job opportunities, and it's going to be it'll be so numerous, but this isn't not just saying it. This is investing smartly, getting into the high schools, getting to the technical colleges, coming here and saying, okay, now there's better alignment today when you look at what the universities are doing, what the technical colleges are doing, what the state is doing, investing in our people. Because I have to be able to look you in the eye and tell you there will be very good job opportunities out there. And there will. Now, a lot of people said it in the past and it wasn't true. It is true now. And I want all of us to take advantage of that opportunity. And that's the excitement that we bring together for this rural health transformation. So I was really happy to get out and talk about this issue, but it's not just a product of the government. Quite frankly, the success of this venture is dependent upon everyone. This was a collaborative process. We have endorsement letters from over 40 different healthcare entities. We have support from our federal congressional delegation, from our House leadership, our Senate president, and also just so many citizens across West Virginia who weighed in directly in the process. We did extensive interviews. We had a lot of roundtables I participated in. I read most of the submissions that came in. There were over 3,000 pages that came in. A lot of great ideas. That's how we built this. We built it through West Virginian ideas coming together. We learned. That's thrilling. We had a town hall. We had 17,000 people on a teletown hall. I mean, we have a lot of things we're doing. And you get ideas from every sector. We're building on that. And that's an opportunity for West Virginia to succeed. So I'm really thrilled to be here and to talk about this issue, because this isn't just about the next 5 years. This is about the next 50 years. What can you do to build the right type of cycle where better health leads to better economic opportunities for our people? I think it will, and I think you're going to see in the next few weeks we have a lot of really positive things in store. We have this big healthcare application. We have a broadband application before the feds, and this has been a lot of work over the last number of years. We have our 50 by 50 energy plan. I'm going to tell you, we're making progress on that. West Virginia is going to leverage its energy resources, and we are going to build on that strength. And we're going to have announcements coming, new jobs, good paying jobs that are coming in. And it's not because we're given $4 billion from the feds. It's because we're leveraging our people, investing in our people. That's what's thrilling about all this. So that's what we've been working on, and I think it's going to lead to some great results. So I want to say thank you for everyone who came here today. We have some summaries we can make available for you. We're working with CMS to figure out when we can release all of this to you. But I can say this. I haven't seen an opportunity like this in the healthcare world for a very long time. I mean, I don't think, quite frankly, I should say, I don't think I've ever seen anything like this. Let's take full advantage of it, and let's bring meaningful improvement to our citizens, from our youngest kids, where you're talking about neonatal abstinence syndrome, right, Jonathan? We talked about that the other day, to attacking substance use disorder, to diabetes, where we got a lot of good ideas. I mean, let's make this happen. So let's go out and celebrate this, but let's leave it on this note. I could use all of your help. Get the word out. We need to implement this the right way. We need to let people know that there's a new era for West Virginia for workforce participation. And West Virginia is going to be in a position to further its comeback story and to soar. So I want to thank everyone for coming here today. I get a little excited and I didn't follow the script. But, you know, this is what we've been working on for a while. I want to thank the First Lady for coming. She's been a great role model. You know, the First Lady's lost over 105 pounds. That's pretty amazing. Yeah. And that's why she puts my 12 pounds to shame. But I've only been at it for about 6.5 months, so give me a little bit of time. And I'm a slow and steady wins the race kind of guy. We grind, and we don't overpromise and overdeliver. I'm hopeful people will learn that about me. But I look out at this room, and I'm inspired for what we're going to be able to do in the future. So thank you very much for having me here, and I look forward to spending a little bit of time saying hello. Thank you, and God bless.